As a member of parliament and as a doctor, I'm a surgeon and I'm dealing with the patients. But as a surgeon, I have to encounter less people, less patients with strokes, but definitely post-operative. I had seen so many patients suffering from hemiparesis most of the times, properly not medically fit, I mean medically unfit patients operated by taking risks. That's my encounter with the patients. In last session, already we had discussed many things, and in this session also experts have given their views, really insightful. But in last session, we had seen that 15 to 18 lakh patients per annum in India. Many gone unnoticed too. That means one patient per every 20 seconds. So can you believe that how many patients have already been suffered from stroke in this, just we had discussed this minutes? 15 to 20% of the patients are below 45. That means, again, it's a matter of concern. 130 to 170 patients per 1 lakh population. Again, data master is there. So he is doing best in his field. Second leading cause of the death after myocardial infarction or cardiac events is the second most common cause of the death, and third leading cause of the morbidity. That's again, I mean, disability. That's again a major concern. And only 22 to 25% patients, I mean, they are going to the stroke-ready hospitals. That's again a major concern. In golden hours, is again less than that. So these are the data. But what can we do for our society? Already we had discussed is the things that happen once stroke has occurred to the patient or deceased. But what can we do on preventive aspect? That's again a matter of concern. And already we had, I think, one book just along with us that had prepared 9 points primary prevention and 6 points for secondary prevention. That's again a major concern, and we have to look in that also. Because research is again a very big role to play. But before that, I would like to say something about Gujarat, because it's again, we are here. How do we make stroke care work on the ground across Indian states? Because health is a concurrent list. Health is a subject of concurrent list, because center guides and state government always implement the things. So we have to take care of that part also. But as far as Gujarat is concerned, we have, every district has at least one medical college. Most of the districts has been covered. And in last, one of our meet was that about, I think, rare disease conference. And that also we have discussed that we have a limited number of center of excellences. So in this particular cases also, we have to include, prepare center of excellences. And if we have a medical college in every district, that can act as a hub, and we can prepare sub-district hospitals or Ayushman Mandir also as a spokes. But for that, ultimately major concern already discussed, that capacity building for the frontliner. Most of the times we can see that ASA workers are the frontliner workers, Anganwadi workers, so many health workers are there, and private practitioners are also there, that just like a BHMS doctor or DHMS doctor or a registered medical practitioner. They are still providing their services in the interior areas of our country, because there are still major part, 100 crore people are there still to cover this part particularly. So we have to strengthen this frontliner. Unless and until we teach them, these are the signs and symptoms of the stroke, we can't reach those patients which had gone unnoticed, and they had gone to the nearby some, what we can say is a local remedian, that desi dawa, in our Gujarati we can say desi dawa, that takes the golden time of that particular patients, and that leads to the permanent disability of those patients, and many of them don't get proper treatment in time. So capacity building is one part again, and saturation of the neurophysicians. I have had one my colleague and my senior under whom I had done my housemanship. Dr. Kalpesh is there, and he is going to take next session on digitalization of our country, particularly, and our subject. So, what is the saturation of neurophysicians and those technicians which are concerned with these procedures? That is quite less. That saturation is a major concern, and that's why we have to prepare this hub and spoke model. That may be the answer, but still we are lacking that particular things, and we have to look after that one. And many things have been discussed, but in Gujarat, I had said that we have one district hospital in every district, one medical college in every district. Under the leadership of Honorable Chief Minister Sri Bhupendra Patel, the state has continued to strengthen health infrastructure, digital health system, and financial protection for the patients. As we had Ayushman Bharat card, PMJY card, and Ma card, Mukhyamantri Amrutam card. That together gives 10 lakh coverage to each and every family who are eligible. And nowadays, above 70, Vai Vandana card is again a major concern, and I mean not concern, but is a major achievement for our government. The health management information system was designated to improve quality health through IT-enabled clinical, diagnostic, and hospital management tools with online review and monitoring at the state level. That's again under progress. And I can say at the leadership level too, Gujarat has a strong governance structure under the visionary leadership of Honorable CM Bhupendra Patel, with the Honorable Health Minister Sri Praful Panseriya currently spearheading the healthcare initiatives in the state. Today, I would like to say with the conviction that the Gujarat is ready to move ahead in building stronger, scalable, and more responsive stroke care architecture across the state. We are ready to support creation of more stroke-ready care centers across Gujarat. We are ready to encourage hub and spoke model that connects the apex hospitals and medical colleges with the district hospitals and peripheral facilities. We are ready to deepen the public-private partnership too. Our goal should be simple and clear: recognize stroke early, transport fast, diagnose quickly, treat in time, and rehabilitate well. This will be our goal, and I would also like to extend an open invitation from this forum. We welcome partnership in Gujarat too. We welcome institutions, experts, innovators, industry, and healthcare leaders to work with us in creating stroke-ready centers across the state. So I'm confident that deliberation in this session will produce practical recommendations for the state and strengthen our collective resource. Again, preventive aspect. We all know that diabetes mellitus and hypertension and sedentary lifestyle, particularly obesity, these are the three major factors in one particular person. Definitely, there are always chances. So we have to identify those particular spots where the density of these patients are more or likely. Then we have to, go for the routine checkup at Ayushman Mandir for particularly those vulnerable populations. So ultimately, throughout the state, throughout the states or throughout the country, we can manage that way too. The epidemiology is particularly the matter of concern, and we have to look at that one. But as far as the preventive aspect is concerned, Ayush Mantri was there half an hour before, so we have to look there also. Because nowadays the epigenetics, that is again a part of our research fellows. The epigenetics has a great role in our upcoming research areas, because till now we can say NCDs, particularly non-communicable disease, mainly they are particularly single gene mutation, that we can say sickle cell anemia, like those diseases are single gene mutation. They come in the we can diagnose as an early stage of life, at the 4 years or 5 years, we can judge. But those multi-genetic mutation diseases, these are all, hypertension, diabetes, these are multi-genetic mutation disorders, and they come in play after 40 or 45, 50 years. So we have to identify those particular factors, epigenetic factors that are affecting the health of the individual. And we can go in that particular area in detail, and that can prevent. As we know, the researchers are here must be knowing the histone and histone tails, and this epigenetic factor, how they are playing role in opening up of those particularly genetic codes. and ultimately that can lead to these certain disorders. So we have also looked after that yoga, and I mean pranayama is a part of the yoga, and again Ayurveda. There are certain environmental conditions we have to look in that matter, and again diet. That our Honorable Prime Minister Narendra Modi ji is always, preferring those millets. We can say is again best for the tummy. Why is the tummy? Then again, sedentary lifestyle or the lifestyle disorder. Again, we are not that much particular in our diet, timing of our diet. I can say if we are looking on preventive aspect, everyone has to be under the guidance of particular dietitian, and we can prepare our time bracket for the diet, and that particular bracket can also lower down our strokes and like sedentary lifestyle diseases. So we can discuss much more, but I think for today, as a doctor and as a parliamentarian, this is enough, and I think I can thank everyone. Thank you very much.
Thank you. Thank you.